everybody. Good evening. Welcome to Haz'el Inspirations. I am so thrilled to have my friend here with me this evening, Amber. We are going to speak upon a subject that most women need to know about. Amber is going to share with us today. She is an expert in the field of maternal and family health. And Amber, I'm going to let you explain a lot of what that interprets to us. Your main role is a doula, right?
Yes.
Am I saying that right?
Yes.
Yes. So please introduce yourself. And girl, let me tell you, really introduce yourself. Everybody, Amber, I met a few weeks ago, and I was very overwhelmed by her presentation at this event and the education and mentorship that she provided to a lot of not only young moms, but moms that have had maybe 2 or 3 births. But we're going to talk about all the benefits of having you in our lives. Okay? So take it away, Amber. Thank you. And thank you for being with us this evening.
No problem. Thank you for having me. So hi, everyone. My name is Amber Mole, aka the Doula Cheerleader. I am a birth and postpartum doula based in Philadelphia, serving clients in Philadelphia, Bucks, Chester, Delaware, and Montgomery County. I've done my doula training through Dona International, as well as Coco Life Black, and I am currently working towards certification. I'm also a child passenger safety technician, and I'm happy to announce that I am a 2024 Black Breastfeeding Week scholarship recipient, thanks to the Earth app. So I will be adding lactation support services in 2025.
Yes, amen. Yes, thank you. So let us know what your role as a doula is. Explain your role and how that would apply to what you're doing today.
Sure. So a doula is a non-medical professional who provides educational, emotional, and physical support during pregnancy, childbirth, and postpartum. There are various types of doulas, but as a birth and postpartum doula, my role is mainly in labor and delivery, and also with the prenatal care as well, helping a mom navigate her prenatal appointments. And even it can come down to the lab results, understanding her levels, the changes in her levels, and signs and symptoms to look out for that should be escalated with the medical care team, just to make sure that she's getting the quality care that she needs for a safe birth outcome.
Okay.
In the labor and delivery room, we love to say we help from the waist up. So I'm not catching babies. I am solely fixated on mom and her support partner, just making sure that they're both doing well and that mom is getting that continuous support throughout labor and delivery, just in case someone has to step out of the room. And again, on that educational piece, making sure that they understand the procedures and medications that are being offered to them, and also considering any alternatives that might be available so that the way they're making informed decisions.
Oh, wow. Where were you when I needed you? Okay, how long has this role been around? Because my children were born back in the 1980s and the 1990s. The doula profession been around?
So the doula profession is not new. It can be traced back to age. The best way to kind of distinguish the doulas, we are non-medical professionals. Our midwives, they have that medical training, so they are able to help deliver. Especially if we're talking about from the birth point of view, we're helping from the waist up. Our midwives are helping from the waist down. So they're able to perform the vaginal exams, monitor the fetal heart rate. In the event of any complications, at say like a home birth, they're able to transfer out at hospitals so that moms can get that care that they need for a C-section or any other interventions that they're not able to perform. There are also midwives in some of our hospitals. Jefferson is definitely one where they have midwives on staff, which I think is amazing.
Yes. Okay. And how long have you been in this profession?
So I've been in this profession for a year. I've known that I wanted to be a doula maybe the past 3 years, and I have a corporate accounting background. So I recently transitioned, but I absolutely love this work.
And when we were at the event, I must admit that the participants that were there, as many of them that came to your table, you kept them engaged and you kept them aware about their opportunity. I saw your cards being passed, out and everything. Yeah, I mean, I hope that they all connected with you, or some of them did.
Yeah, so that was a really great event for us. I actually, at that event, was tabling on behalf of the Earth app, which is a Yelp-like review for Black and Brown women. It allows them to share their birthing experiences with the hospitals and the medical providers. And it's an app that was created by Black women for us, but it's not just for us. It's for all birthing people and their support people. So families are able to go in and leave a review of their prenatal care, their birth experience, the postpartum care, and also the pediatric visits. So we were able to get a lot of great reviews that day, and we'll be raffling off gift cards.
Yes. Now, I know you mentioned that you are based in the Pennsylvania area, but what if, because Jefferson is over in New Jersey as well, what about New Jersey or Delaware?
Yes. So right now, my families have mainly been in like the Philadelphia, even like the kind of Westchester area. But I am interested in serving South Jersey because it's so close to us. However, there are so many doulas, and I love to tell people there's a doula for everyone if you want one. So I'm connected with some doulas who are in like Delco, in Jersey, and agencies that also make sure that we get coverage in those areas as well. So yes, there's still doula support out there.
Yes. Yeah. Well, let me tell you, if I was back in my younger years, anyway, I would love to have you, Amber, as my doula, because mentally, and this is, and you could touch on this, mentally and emotional, a woman goes through a lot of changes when she's pregnant. Yes. Because sometimes you can't keep bigger. So that's a mental change that they go through about their image. Then you go through the cravings of the eating food that you probably never wanted to eat before. And then, you have to adjust to work balance. And you have to, take time for yourself to exercise and to sleep, sleep, nutrition, going to the doctors, getting your checkups. And sometimes, and I've heard this, is that, and I know this personally from myself, is that you don't always have that partner to be there with you at those visits. And sometimes it's hard because, again, you have to balance work. So if both of you are working, sometimes they don't allow you to talk. And I think that's where a lot of legislator comes in with the FML leave and maternal leave. I guess they still call it maternal leave for men too, right?
Yes, I believe some companies distinguish between like maternity leave and then also paternity leave. So it does sound like there are some who are distinguishing the two and providing support for both partners throughout the different phases, which I think is good.
During that 9 months, they're not given as much leeway unless they have, adequate time to take off. Correct. So that's where you would come at and support that mom through her transition, correct?
Yes.
You'll go to the appointments, like you said, you'll help her. And I found that a lot of women, they may not be able to get their prenatal pills because, I don't know, maybe it's an insurance issue. I'm not sure. So some of them take the over the counter, but they're not getting enough nutrients. And I remember, you're eating for 2, you're eating for 3, whether you're having twins or triplets, you got to increase that. And sometimes that's hard for somebody to adjust. So how do you, one, prepare them emotionally and how do you support them in that aspect?
I like that question. So for me personally, before I serve any family, I like to pray on my way to the appointment, or it's virtual. Yes. So I'll pray on my way to the appointment. If it's in person, if it's virtual, I'm saying the prayer before I jump online or on a call. And I just always like to ask to be humbled in this space, to not judge, to do no harm, to cause no trauma, and just be open-minded to someone else's lived experience. So that definitely helps me stay grounded emotionally and mentally in serving. What I've realized is that support is different from everyone. So we might have like an expectation of what it looks like and what the I don't want to say like perfect scenario because there is none. But we might have this expectation of what great care looks like, what positive care looks like. And every family is different. I've actually have never had to attend a prenatal visit with any of my families. Some of them, I know some of the hospitals, they don't allow any additional, I guess you could say like support person outside of a spouse or just specific appointments. And then for some others, they've had their support with them. So sometimes it's us preparing and on the front end with the prenatal visits, questions that we could be asking the providers, concerns that you might have, that how can you format that question? Or maybe it's even the debrief after. You just had this visit. How are you feeling? Did you feel like you were heard? Were you actually being seen in that visit, or was it kind of like an in and out transaction? So I've done a lot of preparation and debrief with my families just to make sure each visit is a better outcome than the last.
Okay. Now, I'm going to ask you a question that may be a little bit unfamiliar with you. Some of the women that have reached out to our podcast have loved ones that are in the system, or they're in the military. And they need a little bit more support dealing with their pregnancy because they're emotionally going through something. Do you provide support over the phone, or is it always in person? Would they be able to reach out to you in a different capacity?
Yes. So I provide in-person and virtual support. It's been interesting because I've had some moms who have reached out to me on the earlier end of pregnancy. So I won't say the waiting game. Like, I love to do a check-in. Again, every family's different. So I'll always ask, what is your preference? Do you want to check in weekly? Is it bi-weekly? Is it monthly? Until we get closer and closer to the due date. Oftentimes those check-ins are virtual. And what's something that's nice, that is new and upcoming, an organization that I am partnered with and have studied under, they have a Doula program, which offers virtual support to families. So if they have any questions, they can just pick up the phone and dial a doula if they're not able to get out to them. And that's something I can share with you to share with the podcast as well.
The reason that I asked that is because with this information, there may be someone want to know more information that lives out of California or Michigan or somewhere. I just want to be able to make sure that they can connect with you either by a telehealth or by a phone. And because I know that you travel. And on that note, how do you keep yourself motivated? What keeps you motivated?
I think the fact that I am passionate about this work is what keeps me motivated. I love the birth experience. I always have since I was a little girl. We were in high school. We actually watched the birth of a baby in sex ed. And from that day on, anytime a video pops on my timeline, whether it's a human or an animal, I will scroll and cheer on for hours. So I think that, like, having that passion for it, but also just the passion to support someone on. Like I said, my business is called the Doula Cheerleader. That's a name that I go by. I was a cheerleader growing up. So that teamwork, that encouragement, that motivation, being able to support someone and see them feel empowered in their experience, that actually keeps my energy up. That's something that motivates me. And I feel like when I get to talk to the families after our visits or even after the birth experience, and they tell me, I'm so glad you were here. I felt like I was heard in this experience. It just further reiterates why I'm in this space, and that keeps me going.
Let me ask you a question, Amber. Do you feel as though sometimes that your heart melts and you become part of their family?
Yes, definitely. Definitely. How you mentioned too, with some of the families who might need like that additional support, who maybe they have a spouse or a partner who's in the military or incarcerated, or maybe there's just been a situation in the family where they're not currently speaking. I've had to show up and be that support person, which is a little, I wouldn't say like an extension of a doula, because I love to say, like, I'm not here to replace anyone. I'm here to add value to the family, more so like an extended family member. But I have had to show up in that capacity. And again, I try to treat no situation different from any other in terms of perception and how I show up and give care. And I just definitely feel like there's been a sisterly bond, friendship bond that has created from those experiences.
Oh my God. And I think that's where, when you're in the health, especially in the healthcare industry, that motivation, that drive, that core component within you, it just blooms, and everybody like gravitates towards you, and they want, to lean on you for support and everything, because whether it's the way that you comfort them, or maybe it's just a single word that you have said to them that helps them. Sometimes, and this is no negativity on any profession, but sometimes we don't need the licensed professional. Sometimes we just need that small component of someone who really cares and can spend the time with us.
Mm. Yeah, and I feel like too, like it's kind of like there's a time for everything. Like we know we definitely need our medical professionals, right? But sometimes,
Yeah.
I think we talked about earlier how like sometimes you're getting hit with all that medical jargon. Like sometimes you just need the very basics. This is what I'm getting. This is what this does. This is what this means. Here are your alternatives for you to make this decision. And maybe it's you need that emotional support to talk through it because you're going through it, and there's a lot of like I said, a lot of emotions that come up in pregnancy. So I feel like everyone in the space is definitely needed. But it's just being mindful, like the emotional intelligence of it all. What does this family need in this moment to help them have the best possible outcome?
Right. And I think that your role, your profession, it's a profession that, how should I put it? You don't put a time stamp on it. It's like, okay, you're looking at your watch and be like, okay, well, I got 15 minutes to see this patient because I got another patient on the way, and I got to see that patient in 15 minutes. I got to get out of here, I got to, whatever. With you and with your profession, I think that quality of time that you can dedicate, because you understand them on a more personal level. Whereas though the doctor looks at them as I won't say a personal level, but they don't deep dive into them as you may, because you're understanding a lot more of the family dynamics. And I think that's what's helping them emotionally and mentally be able to cope. Because I think I share with you how, and that's what another thing I want to talk about when I share with you about the difference between the clinic setting and the hospital setting. The care is totally different.
Mm-hmm. Yeah, there are certain areas, unfortunately, in the US where we would consider them to be maternal healthcare deserts. So maybe closest hospital isn't necessarily within proximity to those who may not have access to like a car. Maybe they have to take public transit, and the next public transit ride could take hours to get to those appointments. And as you're further along in your pregnancy journey, you're going to the hospital, you're getting checked out more frequently. So just the convenience of dealing with that and the other social detriments of health and the things of life that come up on your day to day can be very challenging. So the nice thing is that, yes, they have clinics who can see patients and maybe provide some of that healthcare that would have been provided if there was a full functioning hospital. Downside, though, is that they're not always adequately staffed. They don't always have the necessary equipment to provide all of the necessary procedures and testing that have to be performed. So again, while it's great that it's there because we need care, it's nice that we have people who are willing to give. Sometimes it can also be a detriment and like an added step for someone who's trying to navigate their healthcare. Just make sure that they're well and their baby is well.
Okay. Thank you. Thank you for highlighting that. Now, I know there's much more to cover, but I want to talk about after this beautiful baby is transitioning to this world, and you supported the mom and the dad, and now it's discharge time from the hospital. That postpartum, what role do you play in that postpartum? Because I had postpartum depression. Okay. And it took me about 3 weeks before I started nursing my baby.
Okay.
Because I just could not do it. So tell me about how I should have had you right there with me.
I'm so sorry. I wish you had a doula. And I wanted to mention that too, because you had asked about the term. So again, doula is not a new term. It's not a new profession. It can be traced back to ancient Greek from the term, I believe it's pronounced doule. And there were women who used to provide childcare support to other women in that time. So it's not a new term. It's something that has been coined and popularized here in the US, I believe in like the late 70s. Thankfully, we have more doulas, but there needs to be more awareness around support and how to get connected.
Thank you. I had a history lesson.
No problem.
But although they were around in the 70s, when my children were born, no one advised me of that. And the healthcare system, we're not made aware.
Right. And so there's a big push now. I feel like definitely in a lot of major cities, getting doulas reimbursed through the states so we can service more people, but also just that awareness. Because again, if you don't know, you don't know. And I do think that is a disservice that we have, where we're in the technological age, we're an advanced nation, and we have all of these resources, but we're not doing a great job of getting them back to the people. And then too, like, yes, there are people who might have the list of resources, but they kind of put it to the side. It's a lot to go through when you're going through life. But I think it just puts it back on us again to just make sure that the term service is known and out there. That way you can't forget. Like, you've heard the term, it's there. You have a way to access it when you're ready.
So, and I think we talked about this, healthcare has evolved so much from back in the 70s, 80s, and 90s. I really like the customization of how healthcare is now as far as childbirth. We still have women that are giving birth to children and they're not getting any prenatal care.
Yes.
So, but okay, let's talk about postpartum.
Yes. Because we can go on a completely different tangent for hours, and I love it. So on the postpartum side, like I said, so I am a birth and postpartum doula. I mentioned there are different types. There are some doulas who are just solely birth doulas. They assist with that prenatal support, the labor and delivery, and then maybe they might do 1 or 2 postpartum visits. But their sole focus is birth, so they might defer out to someone else. As a postpartum doula, I will say this, to birth doulas, we do provide immediate postpartum support. So like in that golden hour, we're there to just kind of assist with the initial latching for lactation. As a postpartum doula, so I'm providing service with families beyond the labor and delivery. And so from a training that I really enjoyed with one of my trainers, I love that she prefaced it as postpartum doulas, we work alongside the mother or alongside the birthing person, not for, but alongside, and discuss some of the concerns, which might include postpartum depression. So I'm asking specific questions to see, like, how are things going, how you're doing. If there's a support partner there, that's awesome, because that's like your accountability partner, but they also have that insight. So if I'm saying like, oh, what's sleep look like for you? And your response is good, which is a pretty normal general response. And then I'm asking you, well, what does sleep look like? And which you can remember, because your emotions, your memory is kind of all over the place. You're fixated on taking care of baby and maybe making sure you're good. You tell me, I've gotten a decent amount of hours of sleep. I'm waking up, I feel well rested. And then your partner's like, hey, remember last night you said it wasn't really well. Baby stayed up because of X, Y, and Z. Feeding didn't go too well. You had some issues latching. It allows me to just better assess what's going on and how we can troubleshoot. And I'm not saying that I also always know what's going on, but I think having that additional support person just allows to have a little bit more insight for some of those things that might kind of just go over the head. I know people talk about mom brain all the time. So yeah, as a postpartum doula, I really love to just look at what we discussed in terms of like the postpartum concerns in the beginning before a baby arrives. And then at every visit, I like to ask, what are the goals for today? Like, what is something maybe you want to accomplish that you didn't get to? What do you want to fixate on? Because it can change day to day. And so that could look like overnight support. It can look like older children care. If the family just needs some time to step away, maybe it's to shower, to eat. just spend that alone and downtime in the house, like separate from the children. It could be meal prep. It could be preparation of like the nursery, just getting things together for baby as they're hitting those different developmental milestones.
Okay. Now, do you help connect them with outside services?
Yeah.
Okay. You know that was coming, right?
Yes. So
because that sounds like we need to bring some extra help into the house.
Yes. So again, every is different. Their services are different. Hopefully it's all preference in the contract. But what I love to say is I can't do it alone, and I have no desire to do it alone. There are other great resources out there. I love to consider myself as a resource. A lot of doulas are, because we are in this space and we're constantly like networking. We're just constantly adding to our list of resources. And most of us will have a resource list where we can share that with families. So like I mentioned, I won a lactation scholarship. I don't currently have any specialized lactation training. So there's certain lactation concerns that I can help address from the training that I have received. But there's others that I can refer out to who would be able to troubleshoot with them, whether it's a board certified consultant or a lactation counselor. So I definitely do a lot of that. I feel like that's a lot of the concerns that I get. It's usually around lactation support. Sometimes it's housing, which again, is not my specialty, but I know resources locally that I can refer to. It could be meals itself, like who to contact, and even childcare, like you mentioned.
Goodness, thank you. Do you feel as though that with each interaction with a family member that you are taking a piece of learning tool or skill set that you apply to the next family? Like a revolving door, you're always educating yourself.
Yes.
Do you find that?
Absolutely. Okay. I feel like it's kind of the same way. It's funny, whether it's the first child or like the third, I feel like families are always saying, we're not sure, we're uncertain. And I always say it's a learning experience for everyone, because every baby is different. Every experience is different. So I'm constantly learning from the questions they ask, from the different things that they're doing, and how we troubleshoot, and just always thinking about how can I improve this experience for someone else, or even for like the next visit that we have together.
Okay. Oh my God, you are providing so much information, and I want you to highlight how, because we can't only look at the women. What component have you seen with the father? What barriers have you seen with the father? Because I think from when we were at that event, they were talking about men go through postpartum depression too, right? Or anxiety or separation, something they go through as well, right? So how can we support them as well?
Yes. So definitely there's a space for men. And I feel like, again, it's different for everyone. There's a lot of preparation that people can do in terms of preparing for baby's arrival. But during the process, you don't know how you're going to react until you're there. So the one thing about having a doula in the space is that, like I said, we're not here to replace, definitely not here to overstep. I love to say, as an advocate, I'm here to amplify and echo the voice of the birthing person, the mom, never to take charge of. And that's a nice thing with having that support person in the space, because they're able to do it first. We're able to collaborate. Like if you have any questions, if you're uncertain on how to phrase something, I got you. But to really differentiate, so like doula, we're coming with the skills, we're coming with the experience, we're coming with the expertise, and then that support person is coming in with that known history, that bond with the mother. So there's support with the doula working with the father to not only make sure that mom and baby are good, but also that you're well in that process as you're working with your partner to make sure that they're getting the quality care that they need. And then beyond that, there are great organizations out there. In Philly, we have the Dad Lab, which is a group for fathers to come together and be supported. And then also there's organizations like Daddy University, who trains dads, which I think is awesome, to be doulas. So there are a lot of different avenues. And even some of the local organizations will have events specifically tailored to the men to celebrate and honor the men. There was recently a baby shower a couple of months ago, and they actually did some awards just honoring some of the fathers from their spouses. So there's a space for them. They need the support too. I forget what the actual term is. It's like a hormonal imbalance that happens in that period where it can cause them to become depressed. There are great resources out there for men. And as a doula, as doulas, it is also our job to make sure that they're aware of those resources so that they can also feel supported in that space.
Oh my God, wonderful, wonderful. Now, I'm going to let you have the floor. You have more information here, so go right ahead. I'm done. I'm going to listen.
So really, a main point I wanted to talk about was just the importance of knowing your numbers. So what that looks like is knowing what your blood sugar, your blood pressure, your cholesterol, and your body weight are. Especially for our pregnant women and birthing people, you want to know what your numbers are, because during and after pregnancy, there are a lot of changes happening to the body. And there's what we like to call normal pregnancy symptoms. Like you might hear the weight gain, the nausea, the sweating or swelling, the fatigue. And then there are also warning signs where we might need to start raising that red flag and seeking care. So it's just important to know where you usually stand, and then also being mindful of the activities that you're doing and what time of day that you're doing it. For example, my blood sugar levels want to be different within the first 1 to 2 hours after I just ate a meal. My blood pressure could be off if I have like a long trek to get to my doctor's office, versus if I had some time to wait in the waiting room before I'm being seen. So it's just really good to just be mindful of what they are. Sometimes it's even okay to just say like, hey, doc, I just walked 10 blocks to get to the office and I was seen right away. Could you take my blood pressure in the middle of the appointment versus at the very beginning? Communicating, I had this for breakfast before I came in. My blood sugar's a little high. When I check it at home, it's usually this number. And just letting them know, because we keep track of I'll say this, medical providers keep track of that information. It helps them make diagnosis in the care. But also as a doula, I like to look at those numbers as well, just to see how you're doing and how it fares with the responses that you're getting back to the medical providers. Again, I'm not medical. I'm looking at that as well, because there are things like preeclampsia and gestational diabetes have warning signs. And if your vitals are trending towards those warning signs, I want to make sure that you're communicating that to your provider so you're getting the care that you need for a safe birth outcome. And I've had the pleasure of serving these moms, unfortunately, who had high-risk pregnancies for high blood pressure, for preeclampsia, for gestational diabetes, and preterm labor. And having those open and honest conversations with them, it allowed us to communicate the concerns when their levels were trending towards an unfavorable direction and obtain that quality care. So most recently, I had a mom who gave birth. She would constantly tell me about her doctor's appointments. She didn't feel like she was being heard during her prenatal care. And when we talked during our prenatal visits, we talked about questions that she had, questions that she could ask just based on some of her lab results. And every time we debriefed, she said the provider was just like, oh, that's just normal pregnancy complications. Or if they were concerned about like the trend in her level, they would have her stay for a period of time and then send her home. Towards maybe the last 3 weeks of her pregnancy journey, she started showing trends that were pointing towards preeclampsia. And for those who may not know, preeclampsia is a life-threatening hypertensive disorder that only occurs during pregnancy and postpartum. It can occur up to 6 weeks after delivery. It affects about 5 to 8% of all pregnancies, and early recognition can help save lives. So as I mentioned, we have some of those normal pregnancy symptoms. The symptoms and signs of preeclampsia include stomach pain, feeling nauseous or throwing up. It can be swelling in the hands or in the face that leaves an indent mark. It can be headaches that aren't going away with Tylenol. Any vision changes like seeing spots or blurriness, and then also gaining 5 pounds or more in a week. Preeclampsia can be managed through oral medications or IV, but the only cure of this is to deliver the baby. So with that mom, again, in the last 3 weeks of her pregnancy, I was looking at her vitals. I was looking at the feedback that the doctors were giving. I was asking her what were the discharge instructions. And toward that, maybe that second to last appointment, I was like, hey, this looks like it could be preeclampsia. Again, I'm not medical. I would suggest that you give them a call. She called them several times. She did not receive a call back. So she ended up going into her last appointment. And that is when they started ringing all the alarm bells because she ended up being diagnosed with mild preeclampsia. So again, knowing your numbers, knowing what's normal, trusting your instinct, advocating to be seen, even if they will not see you, that's what we need to do. It's our responsibility. Unfortunately, they should have provided more quality care. In this case, the ball was dropped. And I believe it was later shared that the doctor wasn't paged, so they did not know. But again, no excuse when she called several times to follow up.
I am so shocked to hear it is. Mom and baby okay now?
Mom and baby are well. And that's truly what matters. But I will say, because of that, throughout her delivery, we were constantly just looking at the levels, making sure all was well. When the nurse would come in and do checks, I was writing down them. When she asked, when was the last time we checked you? I could give her the timestamp and what the last reading was. So again, not medical in any way, shape, or form. I don't pretend to be. I don't give out any diagnosis, but that's something that I like to gauge just to help the families understand their readings, what they're getting back from the medical professionals, and those questions that they need to raise.
Right. Oh my goodness. Thank you. Thank you. Oh, that's a touching story. That is such a touching story. Anything else you want to share, Amber? I am baffled behind all that.
Woo! Yeah, it was an experience, but I will say I was really grateful. Despite the prenatal care, I felt like the labor and delivery team were amazing. I'm truly just grateful that it was a safe outcome for both her and baby. I will also just say too, I took a childbirth education course last year before I did my doula training, and it's something that I refer back to for just about everything, every visit. Even when like I'm troubleshooting questions for myself or doing research, I'm always constantly referring back to that childbirth education class. And something that was has been very pivotal to just my understanding of the importance of preparation for childbirth, labor and delivery, and even just as a doula and serving families. The trainer kept saying it starts before labor and delivery. And when she said that, she was talking about advocacy, she was talking about childbirth education. And it was truly about just being prepared, the different outcomes, knowing how to advocate for yourself, knowing what your alternatives are, even just down to the logistics of the facility you're going to, where that OB triage room is if you have an emergency. For those who don't know, some hospitals have what's considered an OB triage. That's like the emergency room for pregnant people. So if there's like a true emergency, you would go to OB triage versus like the main entrance. And others that don't have that, you would go, of course, to like the emergency room.
I don't know about the other hospitals, but I know that virtual offers them. And I think that's the best way to escalate. Oh, Cooper offers it too. They escalate mom and baby to make sure that they're getting the care that they need. So they're not sitting in an emergency room and they really need to be upstairs.
Correct.
Getting that care, getting hooked up to that is okay.
Yes. Yeah. Yes. And I'm glad you just mentioned too, if you're unsure, a hospital tour can be a great way to find out. A lot of our hospitals now are offering them virtual, like the pandemic kind of led them to having to. And then because it works, some of them have stuck with it. Some of them you are able to go in and actually tour the floor itself. But it's definitely good to just take a look at the website, see what they offer. In addition to those virtual tours, a lot of our hospitals are offering childbirth education, parenting classes, lactation support services, support groups during the prenatal and the postpartum period. So there are again, a lot of great resources, but if you don't know, you don't know. But yeah, that was something that she preferenced. And she specifically stated OB triage is different from the emergency room. If you have an OB triage, they're going to be trained to help you throughout your pregnancy. Emergency room, they'll have some base knowledge, but the quality care that you're going to get, that best care is going to be through OB triage if they have one. And I found that so helpful, especially with that childbirth education piece. So the last thing I really just wanted to share when we talk about the importance of informed consent, there is a common acronym we like to use in the birth worker community called BRAIN, use your brain. And that stands for benefits, risks, alternatives, intuition, need more time, or nothing at all. What I love is in this training, she gave us the mnemonic, use your brain and cuss. So it's using that brain mnemonic, but also the cuss part is concern, uncomfortability, safety, and suggestions. So when you put that all together, your questions may look like, what are the benefits of the procedure and medications being offered to me? How might this positively impact myself or my baby? What are the risks associated with this procedure and the medication? Are there any alternatives? And then it might even just be simply stating, hey, I need some more time to evaluate the information that has been provided. Can this procedure or medication be delayed? Can we just watch and wait, see what happens? Or if I decide to do nothing at all, what could happen? So I absolutely love that. And then, of course, that second part of it, the cuss portion would be to express your concern, explain why it makes you uncomfortable, determine if that action will impact your safety or the safety of the baby, and then make other suggestions that help guide the conversation to navigate this positive birth outcome. Because that's the end goal, right? We want it to be a positive birth outcome. Just understanding too, if it's a true medical emergency, we might just have to take the doctors blindly. Like there might not be time to have a dialogue about what happens if at the end of the day we need this to happen for the safety of both you and baby. But if it's not a true medical emergency, knowing that you have agency and choice in your care and you don't have to come in guns blazing, we can do it professionally, respectfully, but also just confidently knowing that you can ask these questions.
Oh, thank you, Jesus. Wow, you have shared so much. Oh my goodness, you are inspiration. And I know you mentioned how our viewers can reach you, but I would like to put your information up on our website. And I would like for you to just highlight how they can contact you again for those viewers that may not go through our website and may just watch this video on YouTube. So how can we reach you?
Sure. So I am at the Doula Cheerleader on Instagram and Facebook. Twitter is like my long lost baby that I've not really poured into, but it's at the Doula Chair. I will be adding some more information towards that, especially as we're coming up on Child Seat Safety Month. Safety, it's like safety, passenger awareness, and just like the safe transportation of our children. So I'll be sharing a lot of information on different platforms about car seat safety checks, definitely the laws as it pertains to Pennsylvania. I can share some information about Jersey. I can also be reached via email, thedoulacheerleader@gmail.com. And I'll share my contact information as well. I know you mentioned for virtual support. If anyone had questions, I have a consultation link where people can reach out to me and schedule a visit for I believe it's either a 20 or 30-minute consultation. But more than happy to talk about what a doula is, how we serve, and how to get connected to doulas in your area. Thankfully, I'm connected to two really great organizations who do service families in the greater Philadelphia area, in South Jersey. I believe we're even into like Delaware County, but also one of my organizations is more national. So should be able to also connect with other doulas who might be targeted in those areas that people are looking for.
Wonderful. Oh my goodness. Wonderful, wonderful, wonderful. Is there any word of advice, any special tip that you would like to leave our listeners, especially the moms that are in that motherly way?
Yes, I love words of encouragement. I would definitely say for moms, there is support for you. I know there's a saying, it takes a village to raise a child. That can be very controversial for some people who do not have that village. I do want to say, though, there is support for you. There are people out here doing this work who are sole focus is on supporting the mother, supporting the family. And if you are interested, we're available. There's a doula out here for everyone. So if you feel like you've done some interviews and you haven't had any good luck, please stay encouraged. Please stay the course. Know that you have agency in your pregnancy. It is okay to ask questions. And if you feel like you aren't being heard, check in, because there are a lot of us out here who are advocating and trying to break down barriers so that way we are all working collaboratively for the well-being of both you, your baby, and your family.
Thank you, thank you, thank you, thank you. Now, is there a time frame that you are like off hours if somebody wanted to contact you?
So I have a scheduling link. It's linked with my Google Calendar. So that'll show, I usually give that out to like my clients That'll show when I'm available. And then through the consultation links I have with Calendly, that'll also show my availability.
Okay.
But I love to tell families, if you don't see a time on there that works for you, please reach out, send me an email, send me a text message. There's flexibility in my schedule right now where I'm able to just work with different families in just the different times, because I understand different time zones. It's okay. Yes. I will not be offended.
It's okay. All right. It's okay. Yeah.
Yes, it's okay. And I hold myself accountable as well. Boundaries, rest are all important. I make sure I get it. So please don't feel offended if you're asking for something outside of my hours. I will let you know, and we'll find something that works.
Okay, I have your information, Amber, and I'm going to put your links in the chat in the website so that they can contact you directly, okay? But awesome. If they need to contact us, we have a chat function on our website. They can send us an email, and I can get it to you as well. And they can call and leave us. All right. You have highlighted a lot this evening. I think that any parent, mom, mother-to-be would be inspired about wanting to help to make sure that their grandchild or their child is coming into the world knowing that they have all the resources that they need. It's not about calling, not making an appointment and going and see the doctor and just that's it. You know, what about what happens after the doctor? You know, sometimes you can't get to the doctor, you know, because you're overwhelmed about what is going on that day. You forget to ask a certain question. So it's kind of good to have somebody to mentor to and to be able to connect with, connecting those links, those puzzle pieces, you know, yes. Making sure that, you know, hey, you know, this is not a bad idea. You know, I mean, we all have questions, and I find out even whether you're pregnant or whether you're going through a transition with cancer or another health issue, you always have questions after we leave the doctors. I have questions. I will leave the doctor and I'll be like, darn it, I just saw him for 45 minutes and forgot to ask what I needed to ask him. So then I'm trying to connect on my patient portal, and then that's when they don't call you back or they don't get back with you for a couple of days, and then be like, I need an answer now. So it's kind of good that we can connect with somebody else. You know, we have that, you know, it's like a hotline for us.
Yeah.
But see, it's a hotline that we're going to use more often.
And that's good. And that's what we want to see. Yeah, that's exactly what we want to see. I love to say, and I feel like a lot of birth workers do, every woman deserves a doula. Doesn't mean that she has to have one, but you should have an option to have one, just to have that companion to walk with you throughout this journey.
Yeah. Yes. Now you're coming back, Amber, in a little while to highlight on other areas too. So I think we got that scheduled in about a week or so. So I'm looking forward to having you come back and highlighting, and I can't wait to have our listeners connect with you. And I hope they feel the same way that I felt when I met you. I felt comfort. I was like, yeah, because I have family members that are transitioning through pregnancies and everything like that, and I see what they're going through. Thank God I'm not going through that right now anymore. My baby's 22. Thank the Lord. But when they start having kids, I want to be able to connect them, because I think that that is a way, because one thing we want to decrease is the blood pressure. We don't want any additive health issues. So if we can decrease in overall health, like you said, we're non-medical. We're just helping with the emotional part. That's doctor's not helping with. He's taking care of the internal. We're taking care of the internal mind as well too. But he's making sure that the baby has all the essentials that he needs to function, as well as the mom does. So they're fixing it, the blood pressure, they're fixing the diabetes, they're fixing the added fluid and things like that. But still, you need to fix the mind, because that's what's controlling all the other stuff. So, So thank you for what you do. Thank you for your profession. I just can't thank you enough. I really wish I had you in my pocket when I was having kids. So. Thank you, our listeners, for joining us. Amber will be back highlighting on more of this subject. She's got more information to share, and our role is a never ending, right? That's right. She's going to share because there's more to talk about. Okay. Thank you, Amber.
Thank you for having me.